September, as we come to the end of the month, it remains National Recovery Month, but efforts are being put forth all throughout the year in order to aid recovery and provide intervention and preventionary services right here in our local area by organizations such as the Alliance of Coalitions for Healthy Communities. Joining us from the Alliance is their Harm Reduction and Recovery Support Director, Steve Norris, on today's edition of The Splash Live. Steve, thank you for being with us today.
Hey, it's great to be here, Tyler. Thanks for having us.
Yeah, glad to have you on to talk about this because it's a complicated issue, but the good news is that when it comes to the complicated issue of drug misuse, drug abuse, addiction, that there are so many resources in our community for those that are affected by their dependence on drugs or on alcohol or on other substances, and for those in their lives too, to provide the services that are needed to help save lives in our local community. And with September being National Recovery Month and the work that you're doing all throughout the year, what can you tell us about the Alliance of Coalitions for Healthy Communities and the services and the resources that they provide in our local area, including here in Oakland County?
Sure. So thank you so much for the question. And there's so many that I probably could go on forever. Let's talk about recovery support for a minute. Recovery support programs that the Alliance offers our community encompass support programs such as Smart Recovery, other modalities for support groups in our community to connect with people in recovery that have already made that choice to start working on themselves, connect them to people locally in their community, if not in other areas that understand their point of view, encourage them to continue on that journey, so on and so forth. We have harm reduction measures within the community that we have deployed and have been very successful with people that are currently struggling with substance use disorder. These are people that are actually in active use. And the purpose behind some of those measures is to try to keep them alive long enough to be able to recover and get enrolled in some of the amazing programs that are offered throughout Oakland County and greater West Bloomfield.
And similar to the mental health crisis, the stigma surrounding substance use disorders and recovery has also been very happily reduced over the last several years. More of a focus has been put on them, even at the governmental level. We've been reporting recently, we've been talking a lot about Oakland County holding listening sessions in regards to the opioid epidemic in our local area and some of the windfall of cash from class action lawsuits that have come into them to talk about what's needed in terms of resources, prevention, intervention, and other resources out on the front lines every day to fight these battles in our community. Speak to the stigma surrounding recovery support and how some of these misconceptions have been sort of snuffed out in recent years, and what sort of misconceptions are still kind of being addressed by organizations like yours to make sure that people in our community that maybe aren't affected by these issues understand what people who are affected by them are going through.
That's a lot of questions there. I'm going to try to answer all of them. Let's tackle stigma for a minute. I think we as a community locally and nationally have started to adopt new language for substance use disorder. We've started to have very difficult conversations, and we have some pretty amazing people that have been able to share their experience with their struggle that has given people the courage to come to the forefront so that other people can see some of the things that they're dealing with. We can bring these things out of the shadows. I always say that people suffer in silence, and when we put a voice, a name, a face, a human being behind the struggle, we get behind that with being able to move towards helping them recover. In terms of some of the money locally that's been passed down from some of the opioid funds, you mentioned Oakland County Health Department having listening sessions. They've been instrumental in us not trying to determine or think we know what our community members need to help battle this, but actually listen to them, listen to their voices, listen to what they think would be good for them and what would be helpful for them instead of trying to assume we have all the answers and the solutions. Um, and actually, those have been very helpful and instrumental in being able to do specific outreach in our community that's going to have some efficacy as a result.
Steve Norris joins us from the Alliance of Coalitions for Healthy Communities, Harm Reduction and Recovery Support Director with the Alliance. You can find more information on resources from the Alliance of Coalitions for Healthy Communities on their website, achcmi.org, or find them on Facebook where we're broadcasting live today, facebook.com/Alliance of Coalitions. And Steve, so much of these different resources and these different support systems that are in place, you've mentioned, circle back to what you said earlier, harm reduction. You've mentioned that term a few times. Dive deeper into that for us and define what that means, harm reduction, when it comes to addressing substance use disorders.
Yeah, so harm reduction encompasses being able to meet people where they're at, to basically mitigate the spread of infectious disease, to reduce the mortality rate or fatalities as a result of synthetic opioids in our drug supply in the community, which is, as you know, unprecedented in the last 3 years. We've seen so many precursor chemicals being mixed with other chemicals to produce effects of other drugs and then passed off as other things. And, when we talk about stigma and all the misinformation and some of those things, the general assumption is that this problem affects people that are using illicit drugs. And the truth is that that's not accurate. This epidemic is touching everyone and everybody that we know. And harm reduction measures such as training people how to administer nasal naloxone in the event of an accidental overdose, testing supplies for illicit or what people are consuming on the street, safe supplies, and connections to community resources and the support programs that exist within our communities, so people can reach out, connect with somebody, get the help that they need before punitive measures have to be taken to address the situation.
And the Alliance of Coalitions for Healthy Communities is providing many of those resources. You mentioned nasal Narcan or naloxone being available all throughout the community. Over 60 plus so-called Save a Life stations that include free Narcan, fentanyl testing strips, and other resources are placed all throughout Oakland County, including several in our local area at some of our local fire stations at West Bloomfield Town Hall, as well as at both the main library and the West Acres branch of the West Bloomfield Township Public Library. But it's one thing to have those resources. It's another thing to know how to use them too, as the name of these different stations says, save a life. So speak to the training that goes into helping the community be able to address these issues and why people should go take some of these training sessions with your alliance and with other organizations to learn how to administer nasal Narcan.
Yeah, so thank you again. I want to give credit to Greater West Bloomfield, and they really pioneered this. They were the first to deploy the stations throughout Oakland County for the Save a Life stations. They were so supportive, from Lisa Berkey at the Greater West Bloomfield Coalition to Dave DeBoer at the fire department to everyone involved at Town Hall, commissioners, everyone involved, Chief Patton, Chief of Police in West Bloomfield, instrumental in getting that out. It is one thing to supply the resources for people to use, but it's also another to teach them why we're using it and how to properly use that. So education is part of that conversation. These boxes bring low barrier access to those supplies. But if our general public doesn't know what it's for or how to use it or why it's even there in the first place, it's not going to get into the hands that it's needed. We feel here at the Alliance and throughout the county that every single person in our community should have the ability to access nasal Narcan so that they can truly jump into possibly reversing an accidental overdose or poisoning. And I've got to tell you, it's probably one of the best parts of my job is being able to meet and talk to the public, open people's minds, change viewpoints, and reduce stigma altogether, and just connect with people on a real human level has been amazing.
You can find more information on achcmi.org. That is the Alliance of Coalitions for Healthy Communities website. You can also find more resources and information on their Facebook page. Follow along with them, facebook.com/Alliance of Coalitions. And we thank them also for joining us live on today's broadcast of The Splash Live. Steve Norris, Harm Reduction and Recovery Support Director at the Alliance of Coalitions for Healthy Communities, has been with us on today's edition of the program. Steve, before we let you go, whether it's National Recovery Month or not, what are some of the many different ways that people can in the community can support the Alliance of Coalitions for Healthy Communities and its efforts in this space now and going forward?
Sure. So the general public can get involved in many different ways. One of the ways they can get involved is to call our organization and volunteer their time. We have train the trainer programs, we have outreach services, we have connections to the community where they can get involved. Some of the other things is just checking out our local events. For example, I'd be remiss without talking about our major funder, which is Oakland Community Health Network. There's a huge celebration for recovery today on Corporate Drive, 5505 Corporate Drive here in Troy, Michigan, where we are coming together to celebrate people in recovery and share our stories. Those are all events where the public can get involved. And of course, as always, people can donate to our organization, whether that's monetary and or time. All of those things can be found on our website, which is achcmi.org. And if people want to get behind this and put in their time and or money, we would absolutely love that. The more, the merrier.
You can also find more ways to get involved by giving them a call, 248-221-7101, 248-221-7101. Steve, thank you so much for being with us.
Tyler, it's been a pleasure. Thank you so much for having us.